Before we begin, please know that some episodes include language that may be sensitive for some people. Welcome to another episode of The Birth Portal. My name is Connie. Today's true story is about a fourth-time mother I'll call Zella. She had midwives before, but this was the first time with me as her midwife. And she was planning a home birth again and had no history of complications in any of her previous pregnancies or deliveries of her 3 children. The only risk factor she had in her pregnancy was a high BMI, or body mass index. A high BMI in pregnancy is defined as equal to or greater than 30, which can influence both maternal and fetal outcomes. Some increased risks to the mother in pregnancy are developing diabetes in pregnancy. We call this gestational diabetes, which is most often managed with dietary changes and exercise, like walking several times a week. Another risk factor is developing high blood pressure, or preeclampsia. There are increased risks to developing blood clots. They can have more difficulty with anesthesia for things like epidurals. Some other risks during labor and birth with high BMIs could be a longer labor, higher rates of needing inductions. An induction is artificially starting labor with medications. There can be an increased risk with assisted delivery, with things like needing vacuum or forceps. There are higher rates of cesarean section births. There can be increased risks with surgical complications, such as infection or poor wound healing. And there can be difficulty monitoring the fetus during the labor. Some of the postpartum risks include postpartum hemorrhage, which would mean a blood loss of more than half a liter. Others have slower healing post-cesarean sections. And sometimes there can be challenges with the initiation of breastfeeding. However, many people with higher BMIs have completely healthy pregnancies and births, especially with supportive and individualized care and having overall good metabolic health and good nutrition and some physical activity. Zella's overall health was good. She never developed gestational diabetes or high blood pressure. Her nutritional intake was good, and she had a good track record with her previous 3 pregnancies and births. I did a home visit at around 36 weeks gestational age, where I dropped off supplies and assessed the home and the location within the home where Zella wanted to deliver. She had a bathroom on the same floor as her bedroom. There were lots of electrical outlets for our equipment requiring it, like our suction machine for babies needing their nose and mouth cleared of fluids, as well as a heating pad where the baby's blankets and the resuscitation area would be set up. And I left emergency medicine placed in the refrigerator if needed. One of her sons was home during the visit and was very excited of the upcoming birth, with plans to be there to watch. At Zella's 39th week appointment in the clinic, she asked if we could do a stretch and sweep to try and get things going. A stretch and sweep is stimulating the cervix with 2 fingers inside the neck of the cervix and spreading the 2 fingers apart as wide as possible on all areas of the cervix. The sweep is an attempt to release the membranes or the bag of amniotic fluid from the uterine wall, not breaking or rupturing the bag. The other part of the stretch and sweep is it can help the body release prostaglandins, which will help stimulate the cervix to prepare for labor. If the cervix is soft and stretchy when this is done, there can be lots of bloody show, which stops soon after. A few women will go into labor right after, but not very many. Some will go into labor within 24 hours, while others, nothing happens. I've done several stretch and sweeps on women that were already 5 to 6 centimeters dilated and they didn't go into labor, so there are no guarantees. About 48 hours after Zella's stretch and sweep, she did go into labor and paged me to come and assess her at home. The sun was coming up as I arrived. The son that was at the home visit was staying very close to his mother, not wanting to miss a thing. Zella was contracting well, but distracted getting breakfast ready for the family. So I set up my equipment in the bedroom, listening to the baby's heart every 15 minutes. After breakfast was served, she came to the bedroom and climbed on her massive king-size 4-poster bed. And I checked her cervix, and she was already 8 centimeters dilated, and I could feel a big bag of membranes bulging with a contraction. The backup midwife was called to come and arrived within 15 minutes. Zella was very quiet lying on the bed, starting to sweat and move her body in a rocking motion with each contraction. It was a beautiful spring morning, and the blinds were open. Something colorful caught the corner of my eye outside, so I stood up thinking it was a red cardinal flying by. But to my surprise, it was Zella's husband in the backyard juggling. And the family dog, a large poodle, was prancing around. About 1.5 hours after her cervix was checked, Zella says she feels rectal pressure and wants to start pushing. Without checking her cervix, I ask if when she pushes and she feels pinching inside near the cervix, she's likely not fully dilated. The eager son sits at the foot of the bed, leaning against the bedpost, ready for the unknown. Zella begins pushing with each contraction and reports no pinching. After about 20 minutes, Zella's labia starts to spread, and we see a bag of water bulging. 3 contractions later, we see dark hair with the bag of water now tight over the head. The son excitedly says, "Wow, Mom, I can see up there." I'm thinking, this is so cool having him witness such a special moment. Zella is so quiet, letting out only soft grunting sounds. Suddenly, she rolls onto her side and grabs behind her upper knee with both hands and gives another good push, which delivers the head with a bag of water still intact. This is not a concern at all, as the baby won't take a breath until born, and was in fact taking in the amniotic fluid within the lungs while growing in the uterus. Babies born in the caul, or with the bag of water still intact, are supposed to be gifted in some way, an old wives' tale. With the next contraction, the baby is born with a big gush as the water breaks, soaking me from the thighs down as I catch the baby and place it on Zella's belly. The son proudly tells Mum, "It's a girl," and moves up to settle beside Zella. I ask him to help me dry off his sister, as Zella grins, enjoying that special moment. Zella delivers the placenta with ease and needs no stitches, and her bleeding is normal. We help her sit up in bed so she can begin breastfeeding. Suddenly, Dad appears and climbs in beside his son to see his daughter, tenderly touching her tiny fingers. And to my surprise, their standard poodle is allowed up on the bed to also greet the newest addition to the family. Thank you for joining me for another episode of The Birth Portal.